We just saw President Trump's first public appearance since he tested positive for the coronavirus. He spoke from the South Lawn balcony in what the White House called a peaceful protest on law and order. Hundreds of people were in attendance there on the White House lawn. For more on the president's health condition, I want to bring in Dr. Neeta Ogden. She's an internal medicine specialist. Dr. Ogden, good to have you with us. This was obviously the first time that we saw the president in person since his coronavirus diagnosis, live there at the White House. I have to say, he looked and sounded very healthy at this point. In your medical opinion, what was your assessment?
Well, yeah, I watched him and I really thought about that day when he returned from the hospital, and I thought that he did look different. On that evening, I felt, and many doctors commented on the fact that they thought he was sort of struggling with his breathing and maybe even using accessory muscles, which is a sign of more, distress. Today, I didn't really see that. I think that he looks better. And it's hard to say, we haven't gotten many metrics from his doctor or from the White House. So all we can say is that he didn't really look breathless, for example, when he was speaking. He likely had makeup on, so it looks like he's, got good color and good energy. He didn't look fatigued to me. So it looks like he's probably headed in the right direction in terms of recovery, but without other substantial data, it's hard to say.
Dr. Ogden, was this a good idea from a medical perspective for the White House to hold this event, especially when the ceremony held in the Rose Garden for Judge Amy Coney Barrett just 2 weeks ago is now being dubbed a super spreader event by health experts?
No, I don't think this was a good idea, frankly. First of all, let's talk about his illness. He was diagnosed, they say, on October 1st, hospitalized on October 2nd, had the signs and symptoms of severe illness. So when we look at the data, the CDC guidelines about a patient like Donald Trump, he should actually be in isolation until October 21st. They recommend a longer isolation of 20 days, not 10, when somebody has more severe symptoms. So there's that he really shouldn't be out speaking loudly to a crowd. The other thing is that we see that people were wearing masks. I didn't see any social distancing. We know that in terms of containing coronavirus, we want many layers of protection. That could include testing people before they end up on that lawn, as well as masks, as well as social distancing. Unfortunately, with this White House, we have this culture of exceptionalism and exemption. In Washington, D.C., outdoor gatherings are not to exceed 50 people. However, that doesn't apply here because it is a federal property. But again, with the White House in the Rose Garden, they didn't really follow up with contact tracing, which is also recommended, and the CDC even offered to step in. So we see that this White House thinks that they're exempt from the rules that apply to the rest of us.
I want to follow up with you on that point, Dr. Ogden. We still obviously have not heard from the White House if President Trump has in fact tested negative for COVID. It seems unlikely that this speech would endanger the health of those who attended. Obviously, it was outdoors. The president was up on the balcony, very far away from the others. We don't have any information about support staff and other people he may have come in contact with, but he is planning rallies for next week in Florida, Pennsylvania, and Iowa. From a public health perspective, does it send the wrong message and false hopes for people about how significant the pandemic is and how quickly one can be cured when the president, who has all the resources at his disposal, is able to do these types of events and not follow the local guidelines in terms of crowd size and social distancing?
I absolutely agree with you on this point, and I think it is definitely sending the wrong message. What we do know is that when somebody has completed their isolation, whether it be 10 days or 20 days, it is recommended that they have, and they want to come out sooner because they're doing better, it's recommended that they have 2 negative tests separated by 24 hours. However, we actually don't have any perfect diagnostic test that tells us when somebody is no longer infectious, especially when they've had severe illnesses like Donald Trump. Now, what I'm worried about is what you're saying. When there's a rally and travel involved and it's the president, there are many, many more people involved. There are people on his team, and they're interacting with others. And you can quickly see how we've already seen this happen in the White House when there are so many different levels of interaction that this thing can get out of control. And there is a total disregard for that when somebody who is on the cusp of just finishing their isolation or getting better is now ready to quickly move into the world and society, and his team and all those people who go back to their homes or interact with people on the campaign trail. I don't hear at all about what steps they're taking to protect the many people that could be involved here. And I think it does show a complete disregard for science and what we know protects people from the coronavirus. I think it also gives this false idea that I think it was just whatever day he ended up back at home when he took off his mask in that dramatic show, there's just this flaunting of the rules, and it sends a message that people may not be as sick with the coronavirus as we hear. But meanwhile, just 2 days ago, a newspaper like the New York Times, I was reading that a security officer of the White House in charge of credentialing is critically sick. This is the person who interacted with many people coming to the White House without masks and without adequate screening. So it's sad that we're getting really the wrong message from our leader.
And certainly for the hundreds of thousands of Americans who have passed away from this virus and the people who still mourn them, this pandemic is very real. All right, Dr. Neeta Ogden, thank you.
Thank you for having me.